Good morning. Welcome to Wright's Insights. I'm Angela Wright with Wright Wealth Management. Today we are talking about Medicare. Fall is in the air, and so is open enrollment. I'm here with Susan Lucas from My Insurance Solutions, who is going to give us a brief primer on the things you need to know about Medicare. If you want a full breakdown, please go watch our video from last year. I'll drop it in the comments below. Susan goes into a lot of detail about how the program works. So today we'll do a brief primer on it, and then we're going to talk about some of the changes and what people really need to understand about what is going on with Medicare right now. Susan, thank you so much for being here with me today. I really appreciate you. How are you?
Hi, I'm doing pretty good. It is going to be a very busy year for Medicare this year. There have been quite a few changes in the industry actually, it's not just this year, it's over the last couple of years. But first, I just want to share a quick reminder. So I'm going to open up my screen here about how the basic program works and what your options are. Can you see that okay now?
Yes, gotcha.
All right, perfect. So when you become eligible for Medicare at age 65, your first goal, I guess, is to make sure that you get enrolled in Original Medicare, which is the Part A and B the federal government provides. With Medicare A and B, that covers approximately 80% of your healthcare needs, but there are gaps. So there are a couple of different ways to fill in those gaps. The first being a Medicare supplement, or also commonly called a Medigap plan, plus a standalone prescription drug plan. With the Medigap coverage, what that does is it pays a portion of, or all of, the 20% that your original Medicare doesn't cover for your medical services. And then you also need to have the prescription drug plan to help pay for your medications, any prescription medications that you may be taking. The second option you have is a Medicare Advantage plan. Medicare Advantage plans are plans that are specific to generally an area, like the county you live in. So usually the plans are designated by the county or your zip code that you live in, and there can be a number of different choices for each county depending on which medical group you use, and things like that. This year, we are seeing that there are a lot of service area reductions for the Medicare Advantage plans. So in some counties where previously there may have been 5, 6, 7, 10 different options for Medicare Advantage coverage, this year there are many less, maybe
Oof.
only 2 or 3 in some counties. So it's going to be very important that you review any communications you get from your current insurance carrier very carefully so you understand if your plan will be continuing in 2026. You will receive either one of or two notices. There is a annual notice of change that tells you what changes are happening to your Medicare Advantage or prescription drug plan. The other notice that you get will be the service area reduction notice. So please read those very, very carefully. And if you need assistance looking at your options for next year, I implore you to find a local agent that you trust. If you don't know somebody, I will be happy to help you if I can. But if I'm not able to, I do have an entire agency of very trustworthy and credible local agents that I can refer you to as well.
So
So
Yeah, question on that, Susan. When you say local, does that mean like somebody's county, city, state? How local does the agent have to be?
So in some cases, it will be somebody who's in the same county as you. I personally like that because that means I'm most familiar with what is
Mhm.
happening in my county. But it's going to be somebody who's within the Bay Area for the most part,
Okay.
and definitely in California.
Mhm.
It's not going to be one of these 800 numbers for something like eHealth online or whatever they
What
call
are
it.
the challenges with those outfits? Like, what's the fear in using the 800 numbers?
So unfortunately, they're basically sales, over the phone sales
Mm,
companies.
yeah.
They have to have some licensed insurance agents, but they really don't understand what is happening locally. There could be changes with medical groups that affect a certain plan. Um, and so even though the Medicare Advantage looks like it's a great plan on paper, the benefits are amazing, the premiums are low, the copays are low. If your medical group isn't contracted with that plan any longer, or that has changed, then it's useless to you. And
Mhm.
unfortunately, those are the things that these large nationwide call centers do not take into account when they're talking to people.
Interesting.
All they're looking at is you get this amount of benefits now. This plan has this amazing, and I'm just going to pick a benefit, over the counter benefit, where you get all this extra money to buy on healthy foods and your vitamins and supplements that aren't over the counter medication, or that aren't prescription medications, for instance. And and that's very appealing to people because money's tight. I
Mm.
understand that. But if the plans doesn't include your doctors, the medical group that you're using, it becomes absolutely useless to you.
And you could end up in a situation where there isn't a doctor available in your area.
And that could happen as well, because there is still the issue that although I think I am seeing some improvements, it's hard to get doctor's appointments. It's hard to establish new doctors, and it can take 3 to 4 months to get that new doctor appointment. So if you have a doctor and you're happy with your doctor, I always try to keep people with their currently established providers.
Sense. Yeah. Interesting.
Um, so let me see the next, let's see, how do I change that? So Angela mentioned at the beginning, we are entering the Medicare annual enrollment season. It officially starts on October 15th and goes to the end of or not, excuse me, not until the end of December, to
Oh,
December
wait until
7th.
Christmas to do
Yeah,
that.
sorry, take that out. It's October 15 to December 7th.
Hmm.
And this is your opportunity to make changes from your current Medicare Advantage or prescription drug plan to a new plan. Again, make sure you read those notices that you're receiving from your plan, your current plan, very carefully. If you are experiencing a service area reduction, that gives you some additional options moving forward for 2026.
Quick
But if
question. If somebody receives the service area reduction and doesn't do anything, are they automatically added to some other plan that's available in their area, or are they
they
up a
are
creek
not.
for the year?
So what would happen with somebody who is in a service area reduction plan is if they don't make an election before the end of December, they actually have an extended enrollment. So they will have through the end of December to make an election that would be effective on January 1st. If they don't make an election on January 1st, they will have Medicare A and B only,
Oh my
nothing else. They still have until, I believe it's till the end of February to enroll in a plan. But if it's after January 1st, even if you find out first thing in the month, oh, my plan has been terminated or I don't have coverage anymore, the earliest you can get coverage then is February 1st. And if you don't find that out until February, the earliest you can get coverage is March 1st.
So there
So
could be a
read
period, a
your
risky period there.
notifications very, very carefully this year. For people who are on a Medicare Advantage plan that is continuing next year and you're happy with the benefits, it doesn't look like there's anything major changing. You don't have to do anything. It will automatically roll over. You will still have coverage on January 1st. Now, in January through the end of March, so the whole first quarter of the year, if you're on a Medicare Advantage plan, and you find out there is a problem that you didn't foresee this fall, then you will have an opportunity to change to a different Medicare Advantage plan or return to original Medicare and a drug plan during that first quarter of the year. And then any other enrollment periods that occur throughout the year are based on life-changing events. So they call it a special enrollment period. It usually has to do with losing your health insurance, retirement or, loss of employer coverage, moving out of the county that you live in into a different zip code or different county or state altogether, gives you a special election period to be able to change your benefits. If you become eligible for Medi-Cal or extra help, that also gives you special election periods, and a diagnosis with certain qualifying disabilities or chronic health conditions may qualify you for special election periods. But this time frame right now, October 15 through December 7th, is the most common time that people are making changes for their Medicare Advantage and their prescription drug coverage.
Speaking of changes, can we talk a little bit about what's going on this year?
Yeah, and I'm going to stop sharing this, I think, if that's okay. Okay, so the industry has been a little bit tumultuous, I guess is the word I want to use, the last couple of years. And you've seen this across the board in insurance. You've seen your car insurance, you've seen your homeowners or your renters insurance. Everything has increased in the last couple of years, and health insurance and Medicare is not immune to that. The other factor that is still causing some fluctuation, especially with the drug coverage benefits this year, is the Inflation Reduction Act. When that was passed, it sounds great. It looks great on paper from a consumer standpoint. However, it has put a lot more pressure for covering the cost of medications on the insurance carriers than on even Medicare or the drug companies. And so that's why we're seeing so many drastic increases on drug plan premiums and even the copays and coinsurances. The good news is, although it has increased this year, your maximum out of pocket on your prescription medication coverage is still reasonable, I would say. It's $2,100 this year. So it increased $100 from last year, or I should say for 2026. So in 2025, it was $2,000 is the maximum you will spend on your prescription medications. In 2026, that will be $2,100. The drug deductible has also increased. It is $590 currently. In 2026, it will be $615. I know that's hard for people. One of the things that was introduced last year, which is available again this year, especially for people at the very beginning of the year when they're refilling their high cost medications, if that payment at the pharmacy is not something that you can afford, there is the Medicare Prescription Payment Program. They call it M3P. That you can enroll in by contacting your prescription drug insurance carrier. So United Healthcare or SilverScript or Anthem whoever it happened, actually Anthem left the market. So not them.
That's
But
fine.
anyway, whoever provides your prescription program,
Mhm.
you can enroll in that by calling your member services number on your ID card.
And are there typically income or asset limits with that sort of help, or is it just a matter of asking and anybody can get the help?
As far as I know, it's just a matter of asking. However, if you have the income to be able to pay it, I would just say go ahead and do it, because
Do your
then
part.
once you've paid it, then your monthly costs will go down significantly after you've met the annual deductible anyway. But for those people where the $615, and it's probably even more than that in your first month, is just not possible, the carrier is required to spread that out over a number
Uh,
of
I
months.
see. We're not
So
waiving it, we're
that,
spreading
so
it for
they,
them for
yeah, they
them.
spread it out. They don't waive it. It's called a premium or a, not premium, copay smoothing program. So
But that's
instead
great.
of you paying, let's just say $700 right then and there at the pharmacy window, if you're enrolled in that M3P program with your insurance provider, they will smooth that out over either the full 12 months or however many months you need to pay it, and
Yeah,
you will pay them directly for your co-pays and co-insurances on your medications.
awesome. That's so great. So speaking of, a lot of people have called saying, am I reading this right? Is my premium doubling for my drug plan? Can we talk about that?
Yeah, so unfortunately, yes, you are reading that right. And the drug plans were not able to increase their premium more than $50, but many of them did take the opportunity to increase their premiums that full
Yeah,
$50. So
yeah.
if you are on a plan this year that is $20.60, yes, it is true that next year it will be $70.60.
And that does not, somebody asked me, does that go towards my $2,000?
No,
No,
the premium does not. The premium is the amount you pay just for the ability to have insurance.
just to
Um,
show up to the party.
Yeah, but there is some good news, I guess. The premium is outside of the $2,100, but the deductible, the $615 deductible is not. So paying that deductible does go towards your $2,100. You've paid half of it already,
Yeah,
actually, if you pay that full deductible in the first couple of months of the year.
good
Um,
point. So people couldn't at least manage their budget. They may have had a significant increase in premium from what they're used to, but they're capped at 2,100 for their out of pocket, going forward on drugs.
Correct, yes. Now,
Mm.
the other thing I will mention about drug plans, because they they tend to be, I drug plan math, I call it, is very confusing. I don't expect you to understand it because I have a hard time understanding it. But what I will say is that you want to, as much as possible, try to use the preferred pharmacies for
Mm.
the drug plan that you're on. I don't care if you love CVS. If their preferred pharmacy is Walmart or Walgreens or any of the other retailers that are still around,
Yeah.
use them because you will get lower copays and co-insurance costs for your medications than going to the pharmacy that you love that is not a preferred pharmacy.
Yeah.
In some cases, the mail order pharmacy is the best deal, but not always. And so, and I don't necessarily do this, but if you have time to play the game and find out what medication costs less at the retail pharmacy and which one costs less at the mail order pharmacy, then you can save some money that way. But
I'll tell you, if you want to get frustrated, try making those phone calls. Like call CVS, who will say, no, call your insurance because they'll tell you how much it's going to cost. And then you call them and they'll tell you, no, you got to call CVS. They'll tell you.
I know it's really crazy, and I'm sorry that that people have to go through this. But anyway.
What we've got to deal with. So I think on drugs, one piece of advice that you always give, which I love, is shop that plan every year. Go into
Yes,
Medicare.gov, type in your medications. That's, I think, is it still worth it to take the time to do that every single year?
absolutely. Yes, because your drug plan was fantastic this year. It covered everything that you had. The co-pays were low, the co-insurances were low. Next year, 2026, completely different ball of wax. Not
Ugh.
only do the formularies change, which
And
means
the
the
tears, right?
yeah, which means the medications that you're taking this year that were all tier one may not all be tier one next year. They may not all be on the formulary next year, but there have been a lot of changes where a plan that previously or currently maybe has co-pays for certain tier levels is moving to a co-insurance, which means it's a percentage,
Mm,
not a set dollar amount. And that could make a really big difference in what you pay for that medication.
right.
So yes, it's a very good idea to still review your drug plan. Even if you've been absolutely satisfied with it the entire year this year, we don't know that it's going to be the same in 2026. And unfortunately, with the drug plans in particular, this is the only time of year that you have an opportunity to make a change. If you miss the open enrollment period and you don't get a special enrollment period next year for some reason, that's it. You're stuck with a drug plan that could cost you twice as much
Ugh,
as it is this year.
gosh, it's worth it to take the time to review that in
So yes,
between
please take
pumpkin
the
spice
time to
lattes.
review your drug coverage between October 15th and December 7th and make a change.
Ugh, awesome. Okay, what else do people need to know from this year? Any other big changes or things we really want people to be looking out for?
I really think that's the biggest, but what I'm seeing in almost every county, especially here in the Bay Area, is that there are very few or much less opportunities or options in the Medicare Advantage side, especially. Many of the carriers have removed contracts. They're doing a service area reduction, or they've lost contracts with medical groups. So again, just read those annual notice of change documents that you're receiving. If they send you an email saying you have to access it online, go onto your, portal and find it, or call if you can't do that, and make sure you get that information. It's very important so that you have coverage, or you can be assured you will have coverage
Yeah.
come January 1st.
I would say, like try before you buy, especially if you're approaching 65 right now. You have 3 months before 65 to sign up. And I had a fellow in San Francisco who had a Kaiser his whole life, got onto the Kaiser Advantage plan, and then there were no doctors in
Yeah.
San Francisco. Like his current doctor couldn't see him anymore. So he's now commuting to Oakland. Like, and that
Yeah.
could have been avoided. He just kind of assumed he could keep his doctor, and
So
that could have been avoided by checking all of that out before purchasing.
yeah, and so that new to 65 timeframe is a really, or new to 65, or if you're over 65 and you just retired and got your Medicare Part B,
Mhm.
um, that's a really special time. You have more options at that time, especially if you consider the Medicare supplement or Medigap plans. In
Mhm.
the first 6 months of your Medicare Part B being effective, or right after you turn 65, you have an opportunity to get a Medigap plan without them looking at any kind of medical history or chronic conditions. So that is especially for people who do have pre-existing health conditions or have had a history of cancer or something, pretty serious. That is the opportunity that they have to get a Medicare supplement. And right now, Medicare supplement, it's not perfect, but it's probably the most stable type of benefit you can get on the market.
Yeah.
So
And what a lot of us, I think, are used to having works, I think, maybe more like that PPO that you had through your job, all of those.
Correct.
More
Yeah,
familiar
Medicare
feeling.
supplement does not limit you to a specific group of doctors, a specific hospital, or even just your local area. Because Medicare is still your primary insurance and the supplement is secondary and just filling in those gaps. You have the entire nation of doctors who accept Medicare anywhere you go in the United States, that are available to you as long as they agree to accept Medicare and they agree that they can accept you as a new patient, then
Mhm.
you can see anybody when you have a Medicare supplement plan.
I think through the years, I found folks slightly happier on the ABD than on the C, unless they kind of grew up in Kaiser and then they tend
Right.
to like the C. But I was thinking about the coverage reduction. Is there any sort of special exception if somebody wants to go back to a Medigap from Advantage if their coverage has been reduced? Like now I don't have an option. Do I still have to qualify?
So that is one of the options they get with a service area reduction.
Be worth looking at if you're in that
Is a
situation.
guaranteed issue on a Medicare supplement plan.
You could get
Now,
that.
they are going to be more expensive, but you have that option and at least you know that you'll have coverage. Um,
Right. Right.
so
Yeah.
I am recommending that a lot to my clients right now.
Awesome. Is it still Plan G also for most folks?
Plan G is still the most comprehensive of the Medicare supplement plans that are available for most people. It varies depending on the carrier. They have different rules about these service area reductions and the guaranteed issue.
Oh, come on.
And I know it's so crazy.
We're
I'm
seniors.
going to help you work through all of that stuff if you contact me about this. But yes, Plan G is the most comprehensive. The other plan that I recommend sometimes is a Plan N. It's very similar to Plan G. However, it has a few co-pays for doctor visits and the emergency room that you would be responsible for, in addition to the monthly premium. On a Plan G, once you've paid the monthly premium and the annual deductible, then after that, pretty much your medical benefits are covered. Then all you have to do is worry about what is my prescription drug plan going to be, because you are required to have a prescription drug plan. Otherwise, Medicare will penalize you in the future.
We talk a lot about that in our last one. So if you want all of those
Yeah.
details, you could go watch that.
So anyway, I appreciate you asking me to do a few brief updates today, Angela. It's going to be quite an interesting year. I've been busy nonstop since October 1st.
It hasn't even
Meeting,
started.
I know, meeting with clients all day long.
I
Calendar,
will say, if you want help, we'll drop Susan's contact information. Please get on her calendar sooner than later. Do not wait until December 13th to start this conversation.
yeah,
It is
absolutely.
worth taking the time to have the meeting, to shop your drug plan. You can always ask questions of me, but Susan is really your expert here. Thank you so much for being here with me today. I appreciate it. It's always a good update.
Absolutely. Thanks, Angela.
See you soon.